So far, we've heard a lot about collaborative research that seeks to make the world a better place by producing discoveries that aid in public health, environmental understanding, and food security. Clinical Associate Professor Helen Brown from the Department of Movement Sciences will tell us about another kind of collaborative research in which communities that benefit from the work actively participate in the research process. Helen's work involves developing culturally responsive evaluations of public health issues, such as obesity and tobacco use, and the products of such research are often the actual interventions she and her collaborators determine to be needed. Please welcome Helen Brown.
Well, thank you for being here today. It's interesting to hear so many different presentations. 13 years ago, I was in a remote Colorado community directing public health, dealing with all kinds of issues on the ground every single day. And then when I came here to the University of Idaho, I had a unique experience to take my public health practice and to fuse it with scholarly methods. The word fusing is to combine or blend together, and I think that's an apt description of my role at the U of I. Fusing evidence-informed practice, scholarly methods with the needs, the possibilities, and the constraints of communities is what shapes the work that I've been able to do with communities. As a public health researcher, as a public health practitioner, I didn't see my role as a researcher. I thought research meant you had a spotlight, a laser focus on one issue, and I was much broader than that. And I've come to see that a better metaphor for this is lantern, that using a lantern diffuses light where we can address and see problems that exist and find practices. I also found that I'm trained in systems thinking and cross-sectoral relationships. So coming into the university and finding 3 boxes and I was told to put myself in 3 boxes was really difficult. And I'm really grateful for my deans and department chairs who had a vision for community engagement and allowed me to do that. I think we're all here today because we have a why. I'm inspired by the speakers that I've heard. The work we do inspires our creativity and our passion and our commitment. And my why is really the elimination of health disparities with the goal of creating equitable health places and spaces for all people. Public health people have models that we follow, and the prevention model is one that's well known to us. A friend of mine told me that I was a utilitarian public health person. I hope that was a compliment. And I thought about the Leatherman. It has multiple tools for multiple aims, and it measures things on the side. My work has primarily been in obesity, and as you all know, it's complex. It's a complicated system. There are no single causal agents, and it's difficult to know where you start, where you jump into this system to start working. And I decided where I would start working was problem identification. Well, when I started working here and I was working with the state, I really discovered that we had serious limitations with the data. It was really hard to know what was working, what wasn't working. It was hard to know who was at risk, who wasn't at risk, and where we should put the sparse dollars that we really had for obesity prevention. So realizing that, I started looking for a way to collect the data that we needed and to share it with people, and I'm really grateful that Blue Cross of Idaho Foundation believed in my vision and supported me in a 2-year odyssey to identify, analyze, collect, and decide what data that we had. We learned many important lessons, and today we're all better off for it in working with obesity prevention, because now we're making better data-driven decisions. We know more about who our target populations are and where the greatest need is. We also have multiple people involved, but I knew it wasn't enough. And I'm very grateful for the Center for Modeling Complex Interactions. I was able to work with colleagues in statistics to derive county-level measures using small area estimate modeling. Why does this matter? Now counties that didn't look any different with regional data knew that they were different. They knew their strategic populations. And now I'll talk about evaluation. I owe a great debt to the Coeur d'Alene people and Miram Health for allowing me to grow my evaluation skills. I first started on the Coeur d'Alene Reservation monitoring nutrition evaluation measures, trying to find leverage points to improve their health system. Miriam Health, formerly known as Benoit Health Center, has been quite successful securing CDC grants to impart more traditional physical activity and healthy eating on the reservation, and I was invited to serve as their evaluator. I'll share a couple examples of these evaluation efforts and the lessons that we've learned from them. Years of reliable nutrition evaluation measures helped us develop the Hess Life Food Project with defensible measures. And when we worked on food projects that had less quantifiable measures, we listened, we recorded, we shared stories and connections about food and their health, culture, and their people. Perhaps some of you might have been here on the day that these canoes were dedicated on Coeur d'Alene Lake. Was anybody here that day? It's a day I'll never forget. I realized what happened that day, on the days leading up to it, and that the days that would follow would never be easily enumerated with the numbers that I needed to provide to the CDC. But using the best scientifically defensible methods I could in a community setting, I went about evaluating program outcomes. With a less than perfect pre and post non-randomized sample of over 500 community members, we learned that building canoes matters. More Native people were canoeing, and most importantly for this project, more women were canoeing. A particularly important role of evaluator is the dissemination of the results to the community. My products are often technical reports. I do this work knowing I'm often unable to publish in peer-reviewed journals. What matters most to me is that I can share the stories, the community stories, in a way that's responsive to their culture and their intentions. A little bit about engaging students in this practice. The tobacco-free campus I hope that most of you enjoy, and perhaps the lactation rooms, were undertaken with students, combining public health methods and scholarly practices. And I've worked with students to assess needs, develop interventions, and to evaluate outcomes. If it weren't for students, I wouldn't be here. I'd probably be in a state or a national level public health agency working on policy. But students, never underestimate your capacity and your skill to make change, to share your knowledge and passion with others, and to realize the impacts that you can and you will make. Last, I'd like to summarize what I've learned. My best results happen when I'm a student of culture and context, when I reach out and connect to partners, when I reach across the university and I work with multidisciplinary teams, and when I realize that improved population health is a long game, and I may never live to see the impact.
Thank you, Helen. I hope the input from these community partners will help shape the effective interventions and for these significant health concerns. Thank you for being here.